Assalamu alaikum dear doctors. In this video I am discussing about pseudo hypoaldosteronism. So pseudo hypoaldosteronism is a condition characterized by problems regulating the amount of sodium in the body. Sodium regulation, which is important for blood pressure and fluid balance, primarily occur in the kidneys. Now pseudo hypoaldosteronism type 1, a rare disorder with aldosterone receptor defects. Decrease the function of epithelial sodium channel ENAC is the major defect. It is in contrast to Liddle syndrome, which is due to increase the function of ENAC. Affected child may present with hyperkalemia, sodium wasting, hypervolemia, and metabolic acidosis. May be autosomal recessive or dominant varieties. Main differentiating features from type 4 renal tubular acidosis is raised plasma aldosterone, while type 4 RTA encompasses the conditions with hypoaldosteronism. So remember, in pseudo hypoaldosteronism, what is we find? That is, there is raised plasma aldosterone level and also hyperkalemia. Now, pseudo hypoaldosteronism type 2, that is, another name is Gordon syndrome, volume dependent hypertension, hyperkalemia, and hyperchloremic metabolic acidosis, raised sodium, potassium, and chloride, dental abnormalities, and short stature. WNK1 and WNK4 gene mutations located on the chromosome number 12 and 17 respiratory, and sensitivity to thiazide diuretics. Now, there's some question common AKP exam. First question is that a 1-month-old female presents with diarrhea and failure to thrive. Weight with sodium is 126, potassium is 6.6, and cortisol of 900. Normal is 500 to 700. She has normal genitalia. What is the diagnosis? So, here all the features: hyponatremia, hyperkalemia, and the cortisol level is high. So, diagnosis is pseudo hypoaldosteronism. And next question is that 12-week-old baby girl was referred with poor feeding, poor weight gain, and a history of previous urinary tract infections and hyponatremia. On examination, there were no any abnormal findings. Initial investigation showed a serum sodium is 125 millimole per liter, potassium is 6.2 millimole per liter, and bicarbonate is about 17 millimole per liter. Urea is 7.0 millimole per liter. Osmolarity is about 271 milliosmol per kg. She has a normal urine microscopy and a normal abdominal and pelvic ultrasound. Additional investigation showed a serum cortisol of 794 nanomole per liter, a normal 17-hydroxyprogesterone, that is 6 nanomole per liter, and a raised plasma renin, that is 35 mole per ml per hour. Normal is 2.8 to 4.5 picomole per ml per hour, and aldosterone is 38,000 picomole per liter. Normal is 100 to 450 picomole per liter. So what is the diagnosis? Here the diagnosis is pseudo hypoaldosteronism, and we are seeing the electrolyte findings, especially hyponatremia, that is 125 sodium, hyperkalemia, potassium is about 6.2, and especially the last line aldosterone level is very high, 38,000. So all are supporting this. Please do subscribe and share. MRCPCH to Dr. Emma Chaudhuri. Thank you.